Hello, this is Angie from Daisy Family Health, and I told you before that I wanted to do a series on different things to keep you healthy, right? So, January, there are about 4 to 5 different awarenesses that we will discuss. This video is going to discuss cervical health. So, this is related to women only. Men, you can listen. That way you can tell your wives, your girlfriends, your daughters, even your mom maybe. Sometimes people are not aware. So what is the cervix? We need to understand what that is first. The cervix is very important because it is a pathway for a child to be born. So you have your uterus. It's kind of like a triangle shaped little thingy. And then on the sides is the fallopian tubes that go out, and the ovaries are on the side of the fallopian tubes. Well, underneath the cervix, underneath the uterus is the cervix. And then underneath the cervix is the vagina. So it's this pathway that the baby leaves the uterus and travels down to be born. Isn't that amazing? So we want to keep the cervix healthy, right? And one way we can do that is cervical cancer screening. All women should begin cervical cancer screening at age 21. It's called a pap smear. And then they should begin HPV screening at age 30. The reason they should begin HPV screening is because HPV causes almost all cervical cancers. And now there's a vaccine for it, and I highly recommend that all boys and girls starting at age 11 get the HPV vaccine. If you're older, like me, it's not recommended. But if you are age, I think it's 11 to, I got it written here. I think they raised it from 11 to 21. Don't quote me. But you should, that part I would have to look up. But it starts at age 11. And before it used to be just girls, but now they're finding out that boys, HPV too, give it to the girl, and she gets cervical cancer. So anyway, how often should you get a pap smear? Every 3 years. How often should you get checked for HPV? Every 5 years. And that's the routine. You should not get a pap smear every year, unless the last one was abnormal, if your provider suggested because you're a high-risk individual, like you have HIV or something like that. So some women are they're baffled because they're like, my doctor said I didn't have to come back for 5 years. I want to be checked sooner than that. Well, you must have had several normals, so you do not need to be checked. Things that you could do to take care of your cervix is to eat healthy, protect yourself during sex. If you are within the right age frame, get the HPV vaccine and look for the signs of cervical cancer, and get your well women checks. I wanted to read a couple statistics to you. So, about 79 million Americans currently have HPV. That's how common it is, and they don't even know they have it. But more than 11,000 women in the United States get cervical cancer. So that's where the concern lies, is because HPV causes almost all the cervical cancers. We want to get screened for it, and we want to prevent it by getting a vaccine, right? And the cervical cancer screening can help detect cells before they turn into a tumor, all right, or turn into cancer. Let's see here. I think I covered everything that I want to cover. There are a couple myths that I wanted to kind of shoot down. One is Once you stop having children, you do not need to get screened. That is not true. You should still get screened. Another myth is I have to get screened for the rest of my life. That is not true. If you are over 65 and for the last 10 years all your tests have been normal, you can stop the screaming. You can stop the screening. So that's nice, right? All right, I'm at my 5-minute mark. I think that is it. So it is Cervical Health Awareness Month. I'm going to be doing some tweets. Make sure you let every woman know. They should still get their well woman checks every year.